Hi everyone, welcome back to my channel. So this is kind of like a last minute type of video. So you're gonna see that it's probably just gonna upload. I'm not gonna have it edited or anything like that. So it's 4th of July, happy 4th of July. I wanted to talk about the big, beautiful bill that just passed yesterday and its impact on those of us that are sick and disabled. I just want to preface this video by saying that I am only talking about American citizens in this video. I'm not talking about illegals or, undocumented people or anything like that. What I'm going to detail in this video applies to American citizens that are receiving, some of these benefits that are going to be affected by the Big Beautiful Bill. The Big Beautiful Bill is also known as the OBBBA. So if you see OBBBA anywhere, or if you hear me use that term or whatever, it's the same thing. It's the Big Beautiful Bill. The other thing to note is that Medicaid is sort of like an umbrella term. Medicaid has different names in each state. In California, Medicaid is called Medi-Cal. You need to check in your own state to see what Medicaid is called. So when you hear me talking about Medicaid, it has a specific name in your state. It's not called Medicaid in your state. It's not called Medicaid in any state, I don't believe. Your state has its own name for your Medicaid program. Medicare is always Medicare. Medicare is the same throughout the nation. So 35% of disabled Americans have Medicaid. So that's a pretty good chunk of us that are disabled. I might not even speak specifically to disabled people because, again, I'm going to be talking about people that have Medicaid and Medicare, and that would just automatically include disabled people. So if I don't specify, disabled or non-disabled, it doesn't really matter as long as you have Medicaid or Medicare. These things will likely, these changes will likely impact you. So basically what the Big Beautiful Bill did is it's going to cut federal spending on these programs like Medicaid, and is expected to lead to an increased cost for individuals that receive these programs like Medicaid, and potentially reduce access to healthcare services for millions of Americans. So how is it going to do that? So it cuts federal Medicaid funding by $1 trillion over 10 years. So basically, what a lot of people have summarized the Big Beautiful Bill. There's a lot in the Big Beautiful Bill, by the way. That's why it's called, the Big Beautiful Bill. This is just one small aspect of it. Well, not one, it's one big aspect of it, but there's other stuff in it. But basically what some politicians are saying is that they're going to cut this Medicaid funding by $1 trillion over the course of 10 years, right? So that's billions of dollars every year, in order to give tax cuts for the very, very ultra wealthy in this country. So basically it's like you have to take from somewhere else in order to be able to give those tax cuts to someone else, right? It's like you have a budget, right? This is a budget, and it's like, well, how are we going to allow these very wealthy people to keep more of their money? Well, we have to take it from somewhere else. We can't just, get money out of thin air. So that's how some politicians have explained this. So where they have looked at is at Medicaid, which is a government or state-run program for healthcare, typically healthcare for the lowest income and most disadvantaged people in this country, as well as a lot of children. So it's going to cut that Medicaid funding by $1 trillion over the course of 10 years. Like I said, divide $1 trillion by 10, it's billions of dollars per year. So it's a lot of money. It also has provisions that could restrict eligibility that could lead to millions losing coverage. And this is where it gets really iffy for those of us who are disabled. And I can't even tell you because I haven't seen anything yet. Obviously, the bill is, I think, just being signed barely today. So we're not going to know how this is going to impact those of us who are disabled, because the president has said over and over again that disabled people are not going to be affected, that seniors are not going to be affected. But from what I've been researching, we are going to be affected. I don't think, I mean, I don't really believe what the president says at this point. But it's like they have to take money from somewhere, right? So, and 35% of disabled Americans have Medicaid. So I don't know if they're going to exclude the 35% of us that are disabled and just take from the other, what is that, 65%? Because 1 trillion is a lot of money, even over the course of 10 years. Like I said, even yearly, it's a lot of money. So they have to come up with this huge number somehow. So what's going to happen is that, again, it's going to restrict eligibility and could lead to millions losing coverage, because they're going to now have probably even more work requirements. Because if you're not disabled, a lot of people that are on Medicaid, that are receiving Medicaid, are already working, right? So the work requirement thing, I feel, is going to spill over to those of us that are disabled. And that's what has me a bit concerned, because we're disabled. We can't work. So, and like I said, a lot of people, the people that aren't disabled that are receiving Medicaid are already working. So where, if there's a work requirement, a lot of those people are going to be like, well, we're already working. What are you going to do? They're going to have to target disabled people. Could limit state-directed payment programs, which states use to provide higher rates to Medicaid providers, improving access. So what I interpreted this as is that, providers are not going to get paid as much. So they're going to end up not being providers for Medicaid, because they're not going to be getting good reimbursements or like fair reimbursements. So that's going to lead to a lot of providers dropping, not accepting Medicaid. And if you know anything about Medicaid, a lot of providers don't take Medicaid regardless. Even, as I speak, a lot of providers don't take Medicaid because they don't reimburse as much as other health insurance. More frequent eligibility checks. This is, again, another thing that's going to disproportionately impact those of us that are disabled. And I didn't see anything saying that disabled people were exempt from these eligibility checks. And I do know that prior to the pandemic, we were getting checked at least once a year. And we had to provide, like bank statements or, say how much money we had in the bank in order to qualify for this. So now they're going to say that they're going to make it more frequent. So I'm hearing stories. It could be every 6 months. It could be, I don't know, but more frequently would mean every 6 months or every 3 months, because at this point, I think it's only once a year. But I think during the pandemic, they stopped those eligibility checks because it was an emergency situation. So that's, again, that one, if you're disabled, it makes it difficult. If you're elderly, it makes it difficult. If you have any kind of issues or cognitive issues, having to do that application more frequently is going to make it harder. So they're basically just making things more difficult, especially if you're disabled. Makes marketplace coverage more costly and harder to enroll in. I don't know if that's referring to the Obamacare. So I'm not sure about that. Prohibits federal funds from being used to pay for Medicaid provided abortions. So again, that's going to impact female health care, and it's there's a lot of other ethical questions behind that one. But that they're simply trying to find a way to deny people abortions without actually changing, state policy, because now it's down to the states, right? So it's going to do all of that. That could also lead to clinics closing, which I will talk about. So it can lead to Planned Parenthood closing a lot of their clinics, that specific thing of having blocking Medicaid from covering abortions. It could lead to hospital closures as well, and destabilize healthcare systems, particularly in rural communities. So that is going to impact disabled people that are out in more rural communities. Disabled people cannot get around as easily. They cannot travel to major cities. A lot of us do anyways. It's very difficult. I've traveled to other countries for medical care, and that's pretty tough. But even just traveling within the United States, would be very difficult for a lot of us with disabilities. So, but actually the hospital closures could lead to a lot of deaths as well, because when the ambulance picks you up, it takes you to the nearest hospital. And if the nearest hospital is gone, where are they going to take you? Reduced access to care and increased out-of-pocket costs. And I'll talk about this in a second. There's going to be more reliance on emergency rooms, which again kind of seems weird, because if they close hospitals, your emergency room is going to be far away anyways. But it also makes it, again, like I said, it's going to lead to more deaths, because the emergency rooms that are still open are going to be overrun with people. It could impact seniors by making it harder for them to access federal programs that help with healthcare and prescription drug costs. So if you remember, under Biden, he brought down the cost of prescription drugs. This is going to now make drug costs more expensive again. So it seems almost like this is basically undoing any of the good stuff that was done during the previous administration. I know, like medications for diabetes, the cost came down for that. They did quite a few things to help with, popular drugs drugs that are used by a lot of Americans, and to reduce the cost for that. So there's a possibility that we could be losing that. I don't know how that's going to affect me. I am no longer really on any kind of prescription drugs. So, I don't know. But a lot of us are. A lot of disabled people are on prescription drugs. So I can't really, for other less popular drugs, I don't know how this is going to affect it. For example, I was on IVIG for a while. I wouldn't say it's not as common as, diabetes medication, but I do wonder how it would affect that drug, because that drug is extremely expensive. Some people incur really high copays for IVIG, even if they have really good insurance. So, that's, again, it's going to lead to more deaths. So again, it will lead to increased costs. So I have something here that gives some estimates. I have some screenshots here. I don't want to write down the whole thing because it was pretty long. So a family of 4 on Medicaid making $33,000 per year could face up to $1,650 in new annual out-of-pocket spending. So if, let's say you're a family of 4, I'm a single individual. Again, I'm giving you a scenario, like an example here, but I am single, and I have read that people that are single and don't have kids are going to be targeted, especially with the work requirement thing. But I don't know if that's going to spill over to disabled people, because I am single and I don't have kids, but I am disabled. So there's a lot of overlapping stuff here. And I don't know. I have a feeling that they're going to use certain things, the fact that I'm single and don't have kids. I wonder if that would cancel out me being disabled. And I wouldn't be surprised if that would be the case. So that a family of 4 on Medicaid making $33,000 per year could face up to a $1,650 increase in out-of-pocket spending. That's Medicaid, right? That's an example for Medicaid. In the ACA marketplace, which is Obamacare, let's say a 60-year-old couple making $85,000 per year who hope to stay on their marketplace plan would see their annual premium costs skyrocket by $15,400 from about $6,900 to about $22,300. should that couple try to save money by buying a lower value plan, they would still have to pay more than $12,600 in additional premium expenses. So it looks like the people that are on Obamacare, which is the ACA, look like they're going to get hit probably the worst. A 60-year-old couple is actually not even really that young. They're close to retirement age. So it seems like a lot of these things are loopholes to make healthcare, to basically to take us back to when healthcare was so expensive that people just didn't get it at all, or when wasn't anything. And I've been there. I did not have healthcare for like 7 years. It's terrible. It's a really awful place to be. This is going to lead to a lot of bankruptcies, a lot of deaths. That's at least what I'm seeing, here. So we covered Medicaid, ACA Marketplace, and now Medicare. So Medicare enrollees with low incomes would be hit hardest of all. And I'm going to tell you right now, a lot of Medicare people on Medicare are low income. I'm low income. I'm on Medicare. Elderly people tend to be low income unless they were super wealthy and worked a lot throughout their life. But most people that are on Medicare are just average citizens, maybe middle class. So if you're on Medicare, an older couple on Medicare living on an annual income of only $21,000 could face an additional $8,340 in healthcare costs each year as a result of the House passed bill. So actually, they're going to get hit harder than people that are getting their insurance from the ACA Marketplace, because at least those people that are getting insurance from the ACA Marketplace are working. But still and yet, here in the United States, people are already struggling as it is with low wages. Even if they have professional careers, they're still not getting paid well. It's still going to impact everybody a lot. But it looks like, for people on Medicare, it's going to be pretty tough. There's also job-based health insurance. So if you're working, you get insurance through your work. You are not exempt from, being punished like the rest of us. A family with job-based health insurance could face up to $900 more in annual spending as their out-of-pocket maximums increase. So that's probably best case scenario if you have a job that provides insurance. So those are just some examples. So people are going to be paying more money out of pocket. I don't know how this is going to apply to those of us who are disabled and very low income, those of us who are on the, I think it's called QMB or OMB program, where you're very low income and you don't have to pay any premiums for Medicare or anything like that. I don't know. I don't know if they're going to take that program away. I'm hearing rumors. I'm seeing rumors and stuff on social media, which I shouldn't buy into, but we'll get to that in a second. The other thing that's going to be affected is SNAP benefits, so basically food stamps. I do receive SNAP benefits. I receive a very, very low amount. I think I receive like $30 per month based on my income of like $1,200 from Social Security. So honestly, I don't know how other people do it, but I think when you have children, you receive more. You receive more SNAP benefits. Still and yet, I've heard that it's just not enough, it's just supposed to supplement, I guess, your own income in order to pay for groceries and stuff. But again, I get $30 and I get $1,200 a month from Medicare. So I don't think they really factor in your income whatsoever. Nobody can live on that. So SNAP benefits will be reduced or eliminated in some cases. I am anxious to see how that's going to go. It's going to be interesting to see, how much they're going to reduce it by, because I feel like it's already pretty low to begin with. At least for me it is. For families, I imagine, I don't know what they would cut from mine. I imagine that a lot of these cuts are going to have to come from families with children, because they are the ones that get the most in SNAP benefits. There's just, like I said, why would they cut? They're going to cut $30 from me as opposed to maybe $100 from someone that has 2 or 3 kids and that could be getting, $500 a month or something in SNAP benefits. I don't know how much families get in SNAP benefits. Let's do a quick Google search of that. How much does a family of 5 get for SNAP benefits? Okay, so for a family of five, let's say, two parents, three kids, the maximum monthly SNAP benefit is $1,158. That's the maximum amount they could receive, and the actual amount will depend on their monthly income and allowable deductions. So the way that I'm looking at it, that's the maximum. So you're looking at probably, I would say, between like 600 and 1,158, depending on what the parents do for work, right? Their income. My $30 is probably, hopefully going to fly under the radar. It's not going to do much. It could be completely eliminated, I guess. But it's looking to me like the reductions are going to have to come from families, people that have kids. And this was another big argument that was made against this bill, is that a lot of kids were going to go hungry because of the cuts to this, because of this bill, the cuts of the bill. So, I mean, that makes sense, because my $30 is not $1,000, it's not $800, it's not $600. You can cut me down to $15, but what would you rather cut? Half of $1,000? That's $500, or half of 30, which is only $15. So it probably is going to disproportionately affect families with kids. So just some little rumors and things that I'm seeing on social media. Social media is not real life, so take everything with a grain of salt. I did see someone on an Instagram post talking about cuts to IHSS, which is in-home supportive services. I am an in-home supportive services recipient. My parents are my designated caregivers. My parents are also retired and live off of Social Security. So you can see the broad impacts that this is going to have if they start to take IHSS. So I saw somebody saying that they were going to make cuts to IHSS, that they were going to start reducing hours. Right now we get what is it? What are the hours? We get 100 hours per month, I think. My parents get about 100 hours per month. So if they cut your hours, obviously you're going to get paid less per month. That is going to impact them because they are living, on Social Security, because they are retired. The only other income they get is from IHSS. So my parents are already kind of at a disadvantage. Do they have savings? Yes. Do they have a house? Yes. But again, it's very expensive. We live in California. It's very expensive to live here. Cost of living is very high. They still have house payments and that kind of thing. So, and of course, if their Medicare costs go up, that's also going to be hard for them, because their Medicare costs are going to go up. And then, and if their IHSS hours get cut, then they'll have less money, less Social Security. They'll be receiving less Social Security and less IHSS as well. So they're going to have cuts to all of their income. That is if they cut IHSS. I personally have not seen anything about this. I just saw somebody talking about it on social media under an Instagram post. So I'm a little worried about that, but I don't want to say that that's 100% true. I believe I read something that said this can also lead to higher Medicare costs. So this bill could lead to higher Medicare costs by blocking access to the Medicare Savings Program, which helps with premiums. So I don't know if that was what I was talking about right now, where you're very, very low income. I think it's called the OMB or the QMB program, something like that, where they waive your oh my God, what is it called? Like your premiums, because you're very low income. So, that it could cause nursing home closures. It could increase the costs for dual eligible individuals like myself that I have Medicare and Medicaid. And it has a temporary increase to Medicare physician fee schedule. So physicians are going to get paid more. So I don't know a lot about those other last ones, but it seems like the people that are going to be impacted the most are the lowest income individuals. I will talk. I do have my IHSS reevaluation at the end of this month. I will talk to my social worker, and then I'll come back and make another video about IHSS specifically, and if there's going to be cuts, we will probably know more by the end of this month. Like I said, the bill is being signed today, so we're going to be seeing these changes soon. But I will let you guys know, and I will update you. I'm just going to upload this video. I'm not even going to edit it. So thank you guys for watching, and I'll see you again soon. Take care.